All right. Well, good morning, everybody. How's everybody doing this morning? Good, I hope. Can everybody hear me okay? Give me a thumbs up or say hello.
Can hear you.
Okay, great. Thanks. Thanks, everybody. So we're going to go ahead and get started, and some other folks may jump on with us as well, but it's my pleasure to welcome you to our next nonprofit listening session on Zoom. As you know, we've been doing these since April, trying to share some different information relevant to nonprofit organizations amidst the pandemic. And so we've done these different sessions on things like mental health or how to fundraise and market during the pandemic. And today we're going to focus a little bit on how you want to reopen your office, as well as some changes to the PPP loan program, which many of you may have taken advantage of, and just some things to think about as we're beginning to reopen. So kind of what we're going to do today, of course, I'm
get a photo opportunity with
everybody, and make sure you mute your mic for me.
And the press reaction to it.
Hold on a second. There we go. Sorry about that, folks. So we're going to have with us, we're pleased to have Eric Chapman, who many of you may have heard as you were getting on the call. Eric's an attorney with CowanPerry, works with many different businesses and nonprofits, been quite busy through COVID, and is also a member of the Community Foundations Board. So we appreciate Eric being here to talk through some best practices here and what we need to know when we're reopening. So a couple things, just as we're going through this session, mute your mic if you could when you're not talking. That just makes it a little bit easier for everybody to hear. And we are recording the session, so folks may listen in or want to come to it at the Community Foundation's website afterwards. And again, muting your mic makes it a little easier to hear. And then we are a relatively small group right now, so we will have a chance for you to ask questions. But if you have a burning question or something, please feel free to put that in the chat. I'll monitor that throughout Eric's talk, and then have those questions for him as well as others we might add afterwards. So with that, I'm going to go ahead and turn it over to you, Eric, and just tell me when you need to advance your slides.
Great, thanks, Jess. I appreciate the opportunity to be here. Hello, everyone. I'm Eric Chapman, as Jess said. We're going to talk a little bit about reopening and some of the facets of that here post-COVID-19, and then a little bit about the PPP Flexibility Act, which just passed, which luckily is confusing, but not as confusing as the CARES and PPP Act. Just with a little background, as Jess said, I've been busy during this past couple months as an employment law compliance specialist. One of the things that I've been doing over the past few months was, first off, helping people implement the Families First and Coronavirus Response Act. And then secondly, is dealing with, OSHA guidance, CDC guidance, state guidance, executive close orders, and anything else you would need to kind of determine what your business should or shouldn't have been doing, or your organization should or shouldn't have been doing during this time. So we're going to walk through kind of my 1,000-foot high level on reopening, and I'm going to direct you to some of the resources that are available for you. And I'll start by saying there are a plethora, a multitude of resources. Many of them are very detailed, and many of them are tailored to specific industries. So that's helpful. So I'm trying to give you the broad overview of things to think about, with the idea that you can then go and use some of the resources that I'm going to direct you to. There are hot links in my slide. I provided the slides to Jessica, and hopefully she can distribute them. If not, my contact information is on the bottom of this first slide, and you can feel free to email me. I'll send you a link to the slides. If you have questions, or don't understand something I said, or want to bounce an idea off me, please just email me that as well. I want to make sure that the nonprofits and organizations in our area are getting the information they need to make the most informed and safest decisions they can. Jess, planning, and I wish that I had a magic kind of one catch-all plan for everyone. I don't, and frankly, that's because every business is a little different, but more importantly, because the coronavirus is a virus and is transmitted in physical proximity. Every physical space for an office, or for a event, or for a manufacturing facility or a retail, they're all different. So it's a little bit of tailoring. So before reopening, or as you begin to reopen, or if you just want to see if you missed any best practices, I would recommend, I say here, you review your federal, your state, your local, your CDC, your grandmothers, your local health department, everyone else to figure out what you're going to do. I've listed kind of the 4 biggies on here, but I'll draw attention to them. The White House put out Opening Up America Again guidelines. Those are very broad guidelines, mostly geared towards the states and ceding a lot of discretion on reopening to the states. Good to be aware of. So when some of these trickle down guidance talk about phase 1, phase 2, that's kind of where that's coming from, but not as boots on the ground implementation. Really good for boots on the ground implementation is Virginia's Forward Virginia Blueprint here. Even better than that, and that was released about a week and a half ago, is the Subpoint Virginia's Reopening Toolkit. This is a very good walkthrough, a checklist of items to consider, mitigating factors to put in place, and things to examine before you reopen. And even more fun than that for me, because I kind of knew all that stuff and was teaching people. Stay back on that slide, please. It's got all of these printouts, all of these PDFs of here's an X, please stay 6 feet away. Please wear your mask when you come to this facility. We're trying to make sure we wash our hands. Here's the birthday song. Just dozens of little PDFs and printouts that you can use at your business to remind people of the guidelines that we've probably all internalized by now, but sometimes overlook. As always, we're going to recommend you keep up with the CDC's infection mitigation strategies. They're obviously not legally required, but not being legally required, they're still the best advice and guidance out there. And you will see that Virginia, at least in its executive orders and reopening, has specifically said that they are following and adhering to the CDC guidelines. So it's imperative that you follow one or the other, and Virginia is going to make you do it, which is great. And then maybe less so for this group, but more so for manufacturing or service industries. OSHA has a guidance by industry, which might not be as useful in this context unless you do a lot of consumer or retail or trying to think of the right word, beneficiaries facing interactions. If you do that, you might look at some of OSHA's guidance by industry, perhaps go to the retail or the banking industry, where they'll talk about some of the different things you could consider. Like in manufacturing, the hot topic is re-choreographing your manufacturing process so that you can maintain social distancing in the workplace, or physical distancing, excuse me. And, things like putting up shower curtains between stations, which is kind of cool, kind of eerie. I asked my partners if we could put up shower curtains around our office, just because I thought it'd have kind of a cool breeze through effect, and that was shot down. But anyway, so what do? You've read all this stuff. You downloaded the 100+ pages. You've gone through it all. You've taken your notes. You got your highlighter. You got yellow. You got green. You got red. Don't do that. Do this. Well, then you turn and you look at yourself. You look at your business. You look at your staff. You look at your physical reality, is what I tell people to do. And I want you to assess that. First off, best practice is teleworking viable for all or a portion of your workforce. If they're not present in the office, there can't be a workplace exposure incident. And that's important to the extent possible. I think until we get some of the vaccine or the possible flattening the curve straightened out, teleworking is going to continue to be a big deal. And if you are teleworking, do you have a teleworking policy? Do you have clear expectations of when someone's supposed to be available by teleworking? Are we doing a good job of making sure that people are tracking their hours? If it's not available, what do you have to address? If you have public-facing facets of your operation, are you able to put into place barriers, physical barriers, whether that's plexiglass or shower curtains or something else that mitigates the potential spread? Do you have an open office, and do you now need to maybe potentially space out offices? If you're a service recipient or you're doing a food bank or distribution, is there a way that you can stagger people who are coming in to use your services, not only when they're in your facility, but also when they are coming to your facility, essentially lining up outside if they're doing that? One of the big, unforeseen issues we thought about was reopening a factory, and we even staggered the start times so people wouldn't queue up at the start clock. But people are creatures of habit, and lo and behold, most of the workers got there early, and we opened the doors. They opened the doors to kind of let everybody in. Everybody's out in the parking lot grouped up and giving each other hugs and elbow bumps and fist bumps, and some mask and some not, and it just kind of destroyed the planning and preparation. And then what can you implement to reduce exposure? And that's where we'll move on to the next slide. And when you're implementing protocols that are going to protect your organization and its workers, or your beneficiaries or your volunteers. The good news here is the federal government has given us enough guidance that you have more latitude than you normally would under the laws. For example, daily temperature checks and symptoms questionnaires for volunteers and for employees are more the norm now. They're no longer being prohibited by the Americans with Disabilities Act. In fact, they're best practices, and we recommend everyone. I mean, I actually get up every morning and check my temperature before I get in the office, and I'm the only one here. But we recommend that you implement those and that you keep and maintain an updated list of symptoms. You know, it used to be just fever, flu, achiness. Now we know, it can be numbness in toes, loss of taste. Some of these things are very odd, and educating your workforce is going to be one of the best things you can do, or your volunteers, to keep them safe. Are there any personal protective equipment that can be implemented or handed out? We can certainly put up signs that the governor has told us that say you need a mask, whether it's a cloth mask or an actual, N95 or KN95 respirator to come into a facility. You can look at whether or not, sorry, I haven't had enough coffee this morning. You can look at whether or not there are other implements you can put into place in the physical workplace to maintain exposure to each other. I've been in a few service offices that are a little tighter in the proximity, that have taken painter's tape, masking tape, and have done flow charts of, we walk through this hallway to go that way, or we walk this way around the desks so there's not any coming and going crossways. And obviously, do you have hygiene supplies that are accessible to the extent possible? Sanitizers, soaps, the bathroom. Some places are propping open doors to prevent high contact areas. You obviously should consider sanitizing and cleaning your high contact areas, whether those are door handles, telephones, copier machines are ones that we see a lot. And how are you going to implement a program to sanitize them or clean them on a regular basis? And then finally, we take all the precautions in the world, and it happens. It's important to have an exposure plan. I don't know if you need a response team. This presentation I've used for a wide variety of organizations and entities, but you should have a response plan. Who is your contact person? If someone calls in and says, "Hey, Eric, I volunteered yesterday, or I was with you yesterday, I woke up this morning with a fever." Who do we get them to immediately? Because that's the person that we need to work with to implement contact tracing. Okay, well, Mr. Chapman, I understand you woke up with a fever this morning. Can you tell me everybody you were in close contact with yesterday or the last few days at our site? And by close contact, we mean within 6 feet of, for longer than 5 or 6 minutes, with a mask, or anybody you were bumping elbows with, or sitting down, you went out for a smoke break with, and y'all took your mask off and we're sitting right there shooting the breeze. So you do that contact tracing so you can identify potential exposures. You can give HIPAA compliant notices to those people. It's not a super complex notice. It's, we have reason to believe you may have been exposed to someone who may have the coronavirus. As a result, we ask you to please go get tested, or not report back to work, or not volunteer at this site until you've gotten a negative test from the health department. Understand we cannot reveal to you where the exposure may have come from, and hope you would respect the confidentiality of that individual, just like we're going to be respecting your confidentiality that you may have been exposed. And then obviously monitor, get those test results, try and find out, see if you have to do any more contact tracing. If one of your contacts, test positive, you probably want to implement contact tracing with them as well. And for employees, for volunteers, especially employees, and we'll talk about that in a second, we want to err on the side of caution without penalizing employees. I don't find the nonprofit world to be terribly punitive when it comes to employees, but you're going to have people who every tickle in their throat is a concern. And in this day and age, in this current context, I'm a little more okay with that than I might have been. There's a level of caution that people are exhibiting that is both encouraging and it's sometimes potentially a little ridiculous. But let's err on the side of caution and make sure that we're doing the best, because an employee who's out of the office is actually protecting the workplace. If there's a reasonable good faith belief that, they have an exposure incident or may be sick, we can advance. This is probably more, next slide. Yeah, this is probably more of everybody knows this meme, right? It's Mike Tyson. You got to be ready to respond. I'm sure he said many famous things. The only one I remember is everybody's got a plan until they get punched. And I think there's some truth to that. So, you know, we put all this together. I've got these great slides, and you're going to walk away from this presentation going, I got this under control. I'm ready. I know what to do. I got my highlighter. I got my posters. I got Post-it notes. I got sanitizer. And consider that exposure incidents or disruptions may not come internally. They may not come from your volunteers, your beneficiaries, your employees. They could come from a supply chain. They could come from vendors who are coming into your facility to deliver things. It could be through the mail, literally like a mailman. We don't believe it is transmitted via contact with objects and packages as easily. It could come from customer or business partner or community partner concerns. They may want to know what mitigating steps you're taking. Or maybe they're not taking enough mitigating steps. Consider asking the people you work with what they're doing to protect your constituents, you know, what they're doing to protect the individuals you're there to serve. And of course, given this is health information, it can always come from public relations. This one drives me nuts because it's so hard. And I've had so many clients get a call from a paper, a newspaper, a blog, a media. I heard you have 29 unreported COVID cases. Is that correct? No, it's not correct. We've had one employee with a confirmed case, and we've had some others that we've sent out for testing, and all have been negative, or we're waiting on the results of a few. Well, can you tell us more about it? Well, no, we can't. That's private health information for these employees, but we're following the CDC guidelines. And of course, there's the people that go straight to print to say, Eric Chapman's company was not immediately available for response. It's like, I always read those statements and I'm like, you texted them, didn't you? And they didn't immediately respond, so you printed. That's really bothersome, but be aware that it is a very heightened, damped up atmosphere, and PR can affect it, and also affect the morale of your employees and the people who receive benefits from you and the people you partner with. It's everybody's on edge, and I understand that, but we all need to try and be a little trusting and work together. So on to our next slide. We're going to go through these next ones a little quicker, but if you've got employees who've been furloughed or laid off or out of the office or just teleworking, this is my recalling employees do's and don'ts. Really comes down to the first one. Just over communicate with them. Let them know what you're considering. Let them know what your plan is. When they get to the office, show them the plan if it's, you know, physical and walking around, and take feedback. They may think, well, you know, you haven't considered that, you know, the refrigerator door handle. And that was actually one that was given to us in our office. So I was like, that's a good point. We all get stuff out of the fridge, and just, I'm sure we would have wiped it down eventually, but little freaky. That's the key to avoid OSHA complaints. OSHA is not super regulating. They keep changing their standards, whether or not they're going to investigate these. And I think they're overwhelmed at the moment with the front line and the medical and more essential manufacturing. But we find the key to avoiding an OSHA complaint is really communicating with your employees and over educating them. And so if you have the ability, give them reasonable advance notice. It takes a little bit of time to get back up to I'm going to go back into this place when we've been on quarantine or lockdown. I mean, I know I get antsy and have to amp myself up every time I decide I'm going to go to Kroger, which is once a week. I'm like, all right, do I have my Kroger game plan? Do I have my mask? Do I have my gloves? Am I going to get a good parking space? So it takes a little bit of time to mentally prepare. So the extent you can do that with your volunteers, your employees, your benefits recipients, those are all good plans. Be willing to discuss obstacles with regard to your employees. You know, they have some rights under the Families First Coronavirus Response Act. We'll briefly touch on the next slide. And if they refuse to come back to work, you should document that just because it's a best practice. Excuse me. Second half, the don'ts are more geared towards employees and more towards probably a larger workforce, but don't forget to extend FFCR leave, Families First leave, if it's applicable. At this point in time, it's probably unapplicable if they're experiencing symptoms, are under a quarantine order from a healthcare provider, or are caring for someone who's under a quarantine order, or they have children whose childcare provider, daycare, summer camp at this point in time is closed because of COVID-related reasons, and they are necessary to care for the child. Again, we've already touched on, don't forget to limit your visitors. Start and stop midweek. If you're going to go into a shutdown, and I don't know how many of you have been in a shutdown, if it can be avoided, do that at the beginning of the week or the end of the week. I say that merely because the unemployment benefits that are currently available in Virginia, any income an employee gets during the week will be counted against that benefit. Virginia only gives you $280 maximum. So if someone made $280 in the week before you shut down and went on leave, they wouldn't get benefits for that week. So that's kind of rough. And then It says your audit your first week back. I wrote that, when people were still just opening up. I say audit every week. Things are changing. But figure out what high touch issues are we missing? What workflow issues are we missing? What can we do better? And we can move on. This next slide here, Jess, if you'll advance, is an FFCRA notice. I'm an employment attorney by trade. I got to say, if you didn't post the FFCRA notice, it's a legal requirement. You can get it at the DOL website. We went through these qualifying reasons, so I'm not going to belabor this slide. I'm going to move on to the next one. Next slide, please, is an odd slide as well. It's from the Virginia Employment Commission. It's the first time I've seen them do this. From what I understand from a few friends who work there, they are completely and utterly overwhelmed by the number of unemployment claims, including those from independent contractors who, wouldn't normally be eligible for unemployment benefits. And they're asking for feedback. They're asking employers and to report whether they recalled someone and they refused to return to work, or if you're using PPP funds to pay people who are on furlough, or you rehired an individual and you just want them to know. That's largely to curb fraud. I like to think that most people aren't out there committing benefits fraud, and I think the vast majority of the time that's the true statement. There are certainly some people doing it. So the VEC is trying to be mindful of your tax dollars, and also be mindful of making sure that people are playing it straight and narrow, because really the punitives, the punishment for tax fraud, it may have seemed like a good idea at the time for benefits fraud, but it's really much worse because it's paying it all back with interest. And if you didn't have the money when you're committing the fraud, it's pretty hard to get out from under that sort of judgment. If we can move forward, and I'm going to try and queue up my slides here. I've completely got out of order. All right, so a lot of you may be on this call to discuss the new flexibility rules for the CARES Act. As you're probably aware, the CARES Act was passed, and part of it was the Paycheck Protection Program, which essentially gave people a large forgivable loan under circumstances to pay payroll, so long as 75% of it was used for payroll and 25% was used for qualifying expenses, which were things like utilities and rent. And it had to be spent in 8 weeks, and had a whole bunch of other little restrictions attached to it. And it was a little bit of a mess when it came out. As a result, and then it ran out of money too. And then there was a second round, which I believe still has money from what I understand. As a result, a lot of people looked around and said, well, I'm closed. I couldn't pay people in 8 weeks. I just can't. This is not a good deal for me. It seems very punitive. So Congress got together and they have updated the law. The Flexibility Act raises not as many, but a lot of questions that the Small Business Association Administration will need to address. My questions are, how does this affect limits on owner-employee compensation, if you're an owner and an employee? And really whether you have to wait, we still don't know the answer to this, whether you have to wait the full 24 weeks because they've extended it from 8 to 24 to qualify for forgiveness, or do the people who qualified under the 8 weeks only have to wait 8 weeks, or do we all have to wait 24, or can I wait 14? We don't know. And probably you'll be working with your banks if you have that money to figure that out. But there were some good changes. So first one we've touched on, they extended the coverage period. We initially had 8 weeks to use our loans to pay them all and get it to qualify for forgiveness. Now they can either do 24 weeks or December 31st, 2020, whichever one comes first. So you've definitely got a little bit more time to work with this. Moving forward. Thank you, Jess. I appreciate it. This one, kind of a mixed blessing. The payroll percentage dropped to 60, as in you would only have to use, you got a $100 loan, you only have to use $60 of it towards payroll in order to be forgiven. It was formerly 75 and 25. That means you've got some more qualified expenses up to 40%, which can be a pretty good deal if you're trying to keep the lights on. For example, if you're a restaurant by paying rent, but with all the distancing guidelines in place and the shutdown, you can't get enough people in to justify having a full staff on the floor. I mean, that's really just the reality of it. The oddity here is, as written, this says if you don't spend 60% minimum, then none of the loan is going to be forgiven. I find that hard to believe when the prior law was, there was just a pro rata forgiveness if you spent less than 75%. But we're waiting on SBA guidance. I think at this moment, best practice, if you can, is spend 60% or more. 61% does fine, just because I'd hate for someone to not have that loan forgiven because they didn't spend enough. It gives us more time to replace what are called full-time employees or full-time equivalents and restore salaries. The previous deadline was June 30th. If you're applying right now, that'd be a really hard one to meet. Again, they've taken this one out to December 31st, 2020, which is reasonable given they extended it 24 weeks. And that gives us a little bit more time to get into reopening and figuring out how we're going to restart our business and things I don't honestly think that Congress could have foreseen when they passed the original CARES Act. And finally, there's some relief for borrowers if you're going to remain partially or fully closed to the end of 2020. And here the relief is really tied to whether or not you were able to bring back certain employees because of work needs or workflow or partial close down. And under the CARES Act and this PPP Flexibility Act, you had to bring back a certain percentage of your workforce or you were going to get dinged for that. If we can move to the next slide, what they've done here is they've said, for most of this year, your forgiveness amount's not going to be reduced when you can show a loss of full-time employees and in good faith document, we couldn't rehire them, flat out couldn't rehire them for whatever reason, or we couldn't rehire similarly qualified employees. We had the positions open, but no one wanted to work, or we could not return. I think this is the most relevant one, to the same level of business as prior to February 15th, because we had to comply with the CDC, the Virginia rules, and any other standards for social, physical distancing or sanitation. Really, that's the one that's probably going to drive most of this exception to forgiveness, this forgiveness inclusion. It is going to be, frankly, the economy's changed a little bit. The ability for us to operate certain establishments, whether they're entertainment venues, whether they're restaurants, whether they're manufacturing facilities, it's just all going to be altered by the business needs due to compliance with a lot of these regulations. And I think we're going to see I suspect a wide amount of latitude in forgiveness under that portion, but documenting it's going to be key. Finally, if we go to the next slide, and I might be running a little early here, but whoever wanted to, didn't want to get out early, PPP repayment and deferral, it's extended the amount of time you have to repay it from 2 years to 5 years. That's pretty nice. It technically only applies for the Flexibility Act, but it also says that borrowers and lenders are free to renegotiate the ones under the CARES Act. And I'd be hard pressed to find a bank, I think, that wouldn't be willing to extend the 2-year government-backed loan to a 5-year government-backed loan, because it seems to me the PR fallout from not doing so would be significant. And then there was this completely messy payroll tax issue in the original CARES Act. And essentially it said you could defer your Social Security taxes until you got loan forgiveness, and then you had to pay them all back. But if you didn't get loan forgiveness, you could defer them till 2021 and 2022. And it caused a nightmare. The IRS didn't know what was going on. The SBA didn't know what was going on. The DOL didn't know what was going on. And like usual, Congress was in the dark. So they did fix it in the Flexibility Act. The latest legislation, it allows an employer to defer payment of all 2020 Social Security taxes, which is pretty good loan to yourself, until 2021 and 2022. And that's, you'll have to pay them, gracious. Now I'm blanking. I think it's December 31st, 2021 and December 31st, 2022, but it may be January 1st. I got to double check that. But anyway, 50% in 2021 and 50% in 2022. It's a pretty nice, if you have a large workforce, a self-loan, or if you have a thin margin on your profit. That is really the update on the PPP flexibility loans. That is my quick and dirty on reopening and recalling workers. And because this is a listening session, I'd like to take the time we have left and listen to you and answer questions you have, because I'm certain that my infinite wisdom and brief spiel on these slides has not covered all the questions that you do have. And I do see one chat. Yeah, I'll absolutely share my slide deck. Jess has a copy of it. She can distribute it, or you can email me if you want to go to the last slide. I didn't put my contact information up there like somebody's not paying attention. But I'm happy to send it to you as well. Just whatever way we can get it to you, I'm happy to do so. And I'll go ahead and put my my email address here in the body of the chat box if you all are following along at home. And that way you can contact me if you have questions you don't want to voice in public, or or you just want to copy the slides, or you just want to shoot the breeze. And I'm pretty bored these days. It's just, hang out, work, hang out with my family. I'm running out of characters I can be in Thomas the Tank Engine and from Toy Story. I think last night my boys made me, they told me to be the castle. I was like, what's that? So what's where they all work? I was like, I can do this. I'll just sit still. Thanks, Jess. Sorry.
Yeah, no, that's great. Thanks, Eric. That was really helpful, and I think those are all things that we should be thinking about. And obviously, as you know, nonprofits are really different in their size and the nature of what they do, but we may not be thinking about some of these questions, and of course the PPP update's helpful. So are there questions from anyone that you want to put in the chat, or you're welcome to just unmute yourself and ask questions. And also be interested to hear how your agencies are reopening, if they are, or whether you're largely working remotely still these days. So it'd be interesting just to hear a little bit, even if you don't have a question, about what your particular organization is doing. And I do have the full list of participants. I'll call you out unless you, anyone wants to kind of say what they're doing.
If no one's going to, I'll volunteer. We have a small office, one in Roanoke and Blacksburg. We have gone to staggered shifts with support staff. We've kind of sequestered off our lobby and have a bell up front. Say your ring for service, sanitizer available. We'll meet you. We ask that you wear a mask. We have some disposable for people to come in. We'll meet you wearing a mask. You won't be coming to the back office. We all stay in our offices while we're here and communicate via text, or honestly, frankly, a lot of times we communicate by yelling down the hallway. And that seems to be kind of effective. What else are we doing that's maybe useful or odd? We made the determination as a group that we don't wear our masks if we are inside an office with a closed door. Private office individually. But most of us do anyway. I took mine off for the presentation. It just looks odd. You can't see half my weird facial expressions. We've set up masking tape. We have sanitizer laying everywhere and wipes next to the copying machine. And I think that's the majority of what we do.
Any other folks want to share what they're doing at their particular workplace? I know at the foundation, just to share what we're doing. So our staff is staggered on days 2. We've just started to move to that in the last couple of weeks. We had kind of 2 staff in, so each one of us was doing a day. Now we're looking to add more days, but still generally not be all in the office at the same time. And if we are, kind of keeping our distance from one another, and then of course wiping down all those common surfaces after each time after we leave. We don't get a whole lot of visitors to our space, but when we do, we talk through with them. They'll come in with a mask, for example, as will we. So trying to just think through ways that we can continue to meet what we need to do within the office itself, because there are still, mail to collect and stuff to do from the office. But we're fortunate that a large majority of what we can do can be done remotely.
I'll chime in about the Moss Arts Center, which is planning to phase in more like August 3rd. I think we're moving to phase 3, and planning on staggered workspaces, never having more than half the folks in at a particular time. We have an open workspace for 12 of the staff. And so we've actually looked at it in terms of sectors and how many people can be present in any one sector of the office, even including the folks that have offices. And on a broader basis, trying to figure out how we're going to navigate having the Arts Center open in general, and having performances in the space. Lots of challenges there.
Thanks, Jamie. Any others who want to talk about what they're doing in their offices, or any questions you have for Eric? Or any questions you may have about the PPP loan? I know many nonprofits did pursue that loan, which was great. We did at the Community Foundation. and have been fortunate to be getting some good guidance from the bank that we work with on when is the right time to apply for forgiveness, which basically thus far we've just been told, hold off and we will tell you when the right time is, but it's not now. But that's certainly been helpful for us.
Probably should mention too, if you have a chance, if you have applied and received PPP loans, or if you haven't and you're going to, there are lots of forgiveness applications. I mean, they've issued the official one. Take a look at it, because it makes it a lot easier to know what you're going to have to track and prove before you file the forgiveness application, which has been useful. Back in the beginnings of this loan, it was very exciting because we were essentially tracking everything. We had no clue what people were going to need to prove for forgiveness. We had clients opening separate bank accounts just for their loan proceeds, so they could track every dollar of it by check. It was a little bit of a nightmare, but the loan for forgiveness, the application is a little more straightforward and maybe not quite as intensive as we had anticipated.
That is good to hear. Any other questions or comments, folks? Okay. We let you off the hook, Eric.
Well, I was going to say, I'll give you a free preview. July 1st, Virginia has multiple employment laws going into effect. It's not a topic of this conversation, but I feel like you should know it. The ones that I would be most aware of in the nonprofit industry is that there's a real push in Virginia to root out misclassification of 1099s, improperly classified 1099s who are in fact W-2 employees. I don't think anyone on this call, or frankly anybody around here, intentionally misclassifies people, but there's now a private cause of action for someone who believes in good faith they've been misclassified. There's a presumption under the law for workers' comp, tax, and under the DOL that if you pay someone for a service and they do that service for you, they are a W-2 employee unless you can prove that they meet the IRS guidelines. And last check, they slimmed them down a little, but the IRS guidelines are like a 20-part criteria to see whether or not the independent contractor. So my advice to everybody in the call would be do a 1099 audit, call your accountant, find out everyone you issued a 1099 to, and just on an ongoing basis. I mean, a one-off probably is not going to hurt you right now, and go back through it and be like, is this an actual 1099 or is this a W-2? If it's an actual W-2, do we really need that person, or do we need to bring them on payroll? Because it's going to be a bumpy 2020 with some of these laws. There's also expansions of protections. I was going to say Virginia was the first state in the South to statutorily protect sexual orientation and gender identity. And that was such a great thing to say. We were going to be able to say it July 1st, and we will, which is great still. But now it's all federally protected, which is even more awesome. I'm very excited about that. And there's a few others batting around out there. There's a prohibition on non-competes. I haven't seen many nonprofits that use non-competes, so that's probably not so much an issue. And there's the increased rate on minimum wage that'll start going into effect, I believe, next July. So if you have any questions about those two, Google them. You'll see lots of blog posts on the Virginia 2020 employment laws.
Right. Thanks, Eric. Okay, well, we'll go ahead and kind of wrap up today then. So just a couple reminders going forward. So I will post online to the Community Foundation's webpage both the recording as well as Eric's slides. So you'll have a chance to see those. Hopefully it'll be by the end of the day today, if not first thing tomorrow, that I'll get all that up there for you. All of our past recordings from our various Zoom sessions are on that same page. Our next call will be July 16th, and we'll post the topic and the link on our events page. So go ahead and just keep an eye on that. If you have, just to kind of skip a bullet for a minute, if you have a specific topic that you want to have us cover, or questions in a particular area that you're struggling with at your organization, we do have a link on the same site where we're posting these recordings, where you can fill out a quick form that just tells us a little bit about the issues that you're interested in, as well as how things are going at your organization. That helps us to figure out what topics to use, not only here, but what we might want to think about going forward. And then finally, hopefully everybody received our announcement on Monday that our responsive grant application is now open. That's our traditional annual grant cycle, but we've made some significant changes this year to make it more flexible and streamlined for you. So this year in particular, we're only going to be giving operating support grants of up to $4,000. So take a look at that. There's going to be some great opportunities to get funding throughout the fall through that program. For those who may have received a COVID-19 response grant from us, you can go ahead and apply for a grant through the responsive grant program as well. You're not excluded because you've received money previously. And then finally, you've probably received a lot of different communications from Ashley on my team about Give Local NRV. I don't have it in my slide, amazingly enough, but our giving day is next Wednesday at givelocalnrv.org. So we hope your organizations are participating. Do spread the word about that. This is another great opportunity to tell the story of your organization and, of course, to raise money to support your mission. So with that, we thank everybody, and thank you so much, Eric, for being a part of this. We really appreciate it, and we'll look forward to seeing everybody back again in July.
Thanks, Jess.
Thanks, everyone.
Thanks, Eric. Thank you.
Bye-bye, all.
Thanks, Eric. Bye-bye.
Bye.
Bye.